Shawn and Sue on 92.7 WOBM. It's a feel-good Friday with RWJBarnabas Health. And joining us is Dr. Chris Buchholz, bariatric and robotic surgeon at Community Medical Center. Doctor, thanks for being with us.
Hey, my pleasure. Thanks for having me.
All right, doctor, tell us a little bit about yourself.
Yeah, so I'm a robotic and weight loss surgeon, as you mentioned, and come from the Midwest. I grew up in Missouri. Went to medical school in Missouri and then headed out to the East Coast to do my training in general surgery and weight loss surgery, and ended up meeting my wife during training, who lived in Toms River, and ended up living in Toms River and have two daughters and trying to get busy at Community Medical Center.
You stayed in New Jersey.
Yeah, exactly. I never thought I'd do that, but now I love it.
Ah, good. Yeah, we love it too.
So, doctor, let's talk about bariatrics. Why and when should someone consider having bariatric surgery?
Sure. So it's not just medical conditions that for why people come in to see us, but it's also things like low energy, low self-esteem. A lot of times people come in saying they feel more tired in the morning than even when they went to bed because they're not getting good quality sleep. People with back pain, knee pain, really come seek our advice, and we're able to provide them with a full suite of options.
So who's the candidate for bariatric surgery?
The organizations go by is the height to weight ratio, and that's called the body mass index. So once a body mass index is above 35 with medical problems such as diabetes, high blood pressure, high cholesterol, sleep apnea, or greater than 40 body mass index with no medical problems are a candidate for surgery.
Now, are there benefits to having bariatric surgery in addition to weight loss?
Yes, absolutely. You know, people come back to us 1 week, 1 month after surgery and say, wow, I have so much more energy. I feel better about myself, feel like they're sleeping better. But in addition to that, medical problems improve dramatically. We have people leaving the hospital off their diabetes medications, off their high blood pressure medications. It's really remarkable how quickly it targets the metabolic fat in our bodies and is able to improve our insulin sensitivity, decrease our chance for heart attacks, strokes, and people don't know, but excess weight is also associated with cancer risk. So by having the surgery and losing weight, people decrease their chance for cancer.
So we are talking to Dr. Chris Buchholz from Community Medical Center. So how does a person get started with bariatric surgery? What is one to do? Like, what do we do?
Somebody comes to our office at Advanced Surgical and Bariatrics, affiliated with Community Medical Center, and has a consultation with one of the specialized 8 surgeons in our group. We sit down, have a consultation, going over a person's medical issues, their goals, previous surgeries, and what we have to offer. So it is a bit of a process in New Jersey. You know, the person has to see a nutritionist and a psychologist, and depending on a person's medical conditions, certain providers to get clearances. But once all that's done, we're able to provide the best surgery that fits the patient's needs, and usually it's about a 2 to 3 month process.
Doctor, what sets the weight loss surgery program at the Center for Bariatrics at Community Medical Center apart from others in the area? Absolutely.
We provide consistent quality care with excellent safety record. I'd say, you know, we obviously want to help patients reach their goals, and we have an outstanding record of helping people achieve their goals, but we want to do it in a safe manner, and we really take pride in our excellent safety record. The national organizations have given us their gold seal of approval for multiple years. We have the highest distinction among the insurance companies because of our quality results and high safety profile. And we're a center of excellence. We're a center of excellence for bariatrics and hernia surgery.
Hey, that's good to know. Hernia surgery, too. All right. So last question. We promise you. What are the different types of procedures? Oh, two. I'm sorry. How do you know which is best for you when it comes to these procedures, doctor?
Sure. We have a very individualized approach, so we don't feel like it's one size fits all. We have the consultation with the patient and, again, talking about patient's goals and maybe symptoms. Some people have reflux disease or heartburn as well. So we talk about what surgery fits a certain person. But in addition to the laparoscopic and robotic procedures, which are the sleeve gastrectomy and the gastric bypass, we also offer endoscopic procedures to help people lose weight. Some people want to attempt a more non-invasive method first, and then we're able to increase that to laparoscopic or robotic procedures for more lifelong improvement.
Oh, wow. That is pretty neat, the way everything gets better and better. You know, I mean, it's just amazing. It's amazing, doctor.
Oh, absolutely. And, people come to us with fatty liver disease, and it's really that fatty liver disease that contributes to a whole host of medical problems, like I mentioned, diabetes, high blood pressure, high cholesterol, increases people's risk for heart disease. That all improves with these bariatric and metabolic surgeries.
It's amazing.
We want to thank Dr. Chris Buchholz, bariatric and robotic surgeon at Community Medical Center in Toms River, for joining us. For more details, go to rwjbh.org. Doctor, thank you so much.
Absolutely. Thanks for having me.
Thanks, doctor.